Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. All of the following are common signs and symptoms of phlebitis except Option A. Pain or discomfort at the fourth insertion site. Option B. Edema and warmth at the fourth insertion site. Option C. A red streak exiting the fourth insertion site. Option D. Frank bleeding at the insertion site. Right answer is Option D. Frank bleeding at the insertion site. Phlebitis, the inflammation of a vein, can be caused by chemical irritants, IV solutions or medications, mechanical irritants, the needle or catheter used during venipuncture or cannulation, or a localized allergic reaction to the needle or catheter. Signs and symptoms of phlebitis include pain or discomfort, edema and heat at the IV insertion site, and a red streak going up the arm or leg from the IV insertion site. The best way of determining whether a patient has learned to instill ear medication properly is for the nurse to Option A. Ask the patient if he or she has used ear drops before. Option B. Have the patient repeat the nurse's instructions using her own words. Option C. Demonstrate the procedure to the patient and encourage to ask questions. Option D. Ask the patient to demonstrate the procedure. Right answer is Option D. Ask the patient to demonstrate the procedure. Return demonstration provides the most certain evidence for evaluating the effectiveness of patient teaching. Which of the following types of medications can be administered via gastrostomy tube? Option A. Any oral medications. Option B. Capsules whole contents are dissolved in water. Option C. Enteric coated tablets that are thoroughly dissolved in water. Option D. Most tablets designed for oral use, except for extended duration compounds. Right answer is Option D. Most tablets designed for oral use, except for extended duration compounds. Most tablets designed for oral use, except for extended duration compounds, can be administered via gastrostomy tube, capsules, enteric coated tablets, and most extended duration or sustained release products should not be dissolved for use in a gastrostomy tube. They are pharmaceutically manufactured in these forms for valid reasons, and altering them destroys their purpose. The nurse should seek an alternate physician's order when an ordered medication is inappropriate for delivery by tube. A patient who develops hives after receiving an antibiotic is exhibiting drug. Option A. Tolerance. Option B. Idiosyncrasy. Option C. Synergism. Option D. Allergy. Right answer is Option D. Allergy. A drug allergy is an adverse reaction resulting from an immunologic response following a previous sensitizing exposure to the drug. The reaction can range from a rash or hives to anaphylactic shock. A patient has returned to his room after femoral arteriography. All of the following are appropriate nursing interventions except Option A. Assess femoral, popliteal, and pedal pulses every 15 minutes for 2 hours. Option B. Check the pressure dressing for sanguineous drainage. Option C. Assess vital signs every 15 minutes for 2 hours. Option D. Order a hemoglobin and hematocrit count 1 hour after the arteriography. Right answer is Option D. Order a hemoglobin and hematocrit count 1 hour after the arteriography. A hemoglobin and hematocrit count would be ordered by the physician if bleeding were suspected. The other answers are appropriate nursing interventions for a patient who has undergone femoral arteriography. The nurse explains to a patient that a cough, Option A, is a protective response to clear the respiratory tract of irritants. Option B is primarily a voluntary action. Option C is induced by the administration of an antitussive drug. Option D can be inhibited by splinting the abdomen. Right answer is option A. Is a protective response to clear the respiratory tract of irritants. Coughing, a protective response that clears the respiratory tract of irritants, usually is involuntary. However, it can be voluntary as when a patient is taught to perform coughing exercises. An antitussive drug inhibits coughing. Splinting the abdomen supports the abdominal muscles when a patient coughs. An infected patient has chills and begins shivering. The best nursing intervention is to option A. Apply iced alcohol sponges. Option B. Provide increased cool liquids. Option C. Provide additional bedclothes. Option D. Provide increased ventilation. Right answer is option C. Provide additional bedclothes. In an infected patient, shivering results from the body's attempt to increase heat production and the production of neutrophils and phagocytic action through increased skeletal muscle tension and contractions. Initial vasoconstriction may cause skin to feel cold to the touch. Applying additional bedclothes helps to equalize the body temperature and stop the chills. Attempts to cool the body result in further shivering, increased metabolism, and thus increased heat production. A clinical nurse specialist is a nurse who has option A. Been certified by the National League for Nursing. Option B. Received credentials from the American Nurses Association. Option C. Graduated from an associate degree program and is a registered professional nurse. Option D. Completed a master's degree in the prescribed clinical area and is a registered professional nurse. Right answer is option D. Completed a master's degree in the prescribed clinical area and is a registered professional nurse. A clinical nurse specialist must have completed a master's degree in a clinical specialty and be a registered professional nurse. The purpose of increasing urine acidity through dietary means is to option A. Decrease burning sensations. Option B. Change the urine's color. Option C. Change the urine's concentration. Option D. Inhibit the growth of microorganisms. Right answer is option D. Inhibit the growth of microorganisms. Microorganisms usually do not grow in an acidic environment. Clay-colored stools indicate option A. Upper GI bleeding. Option B. Impending constipation. Option C. An effect of medication. Option D. Bile obstruction. Right answer is option D. Bile obstruction. Bile colors the stool brown. Any inflammation or obstruction that impairs bile flow will affect the stool pigment, yielding light, clay-colored stool. Upper GI bleeding results in black or tarry stool. Constipation is characterized by small, hard masses. Many medications and foods will discolor stool. For example, drugs containing iron turn stool black, beets turn stool red. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.